There we go, you can have your finger back now.
Thanks.
Michael, it's really good that all your tests are stable, your CAT score's stable, or your blood tests are stable. It's really good to see that you're looking after yourself. Michael is visiting the practice today to review his chronic disease management plan. After my initial assessment, I checked with him to see if there were any other concerns. At these appointments, aside from checking out what's happening with your body, we also like to give you the opportunity to tell us what's concerning you so we can help with that. So is there anything concerning you?
I must have been a little worried about what happens if something at home happens. What does she do? Ring an ambulance? I don't know if I really want that. I would like to stay away from hospitals as long as I can. But then, if I get seriously ill, is it going to be too much for her?
I can understand why you'd be concerned about that. Some things we can do. We can put you in touch with some community services, some palliative care or some home nursing services that might be able to help you at home.
No, I don't think we need that yet. No.
I can understand that. But what about if you did fall? What would happen?
I don't know.
Something you could be thinking about now would be someone who could speak on your behalf if you couldn't speak for yourself.
Well, wouldn't they just ask me?
Yeah, they probably would. But you need to know what's important to Michael, what sorts of decisions you'd be making on his behalf.
We've talked about that.
That's really fantastic. So Sherry would know what you'd want if you did collapse and if you did need to go to hospital?
Well, we haven't really talked in that detail yet because, I mean, we don't know what's going to happen.
Yeah, it's hard to know what's happening in the future. None of us have got a crystal ball. Mine's broken. It is important to have a chat about that. It's important for us to know what you would want so we could act on your behalf.
Right.
So there's a 5-step process involved with this. You've already obviously started the process. You're thinking about it, and that's the first step. The next step is to talk with someone about it. You've started talking with Cherry. Yeah. That's really great. The next part of the process would be to formally appoint that decision maker, someone who could speak on your behalf if you couldn't speak for yourself, someone who's confident, who knows what you would want. Mm-hmm. Yeah. The next part of the process is to write it down. Writing down what your wishes would be if you couldn't speak for yourself, so we can all work off that same page, and then sharing it with the healthcare team, so with the hospitals, with anyone else who's caring for you. It's not written in concrete, it can change as things change for you at home, as your health changes. So what we can do for you today is to give you some information to take away, maybe a form to fill in. You can think about it and have a chat with each other. I can record it in your notes so that you can bring it up with the doctor next time you're here. Would that be okay?
Yeah, no, that sounds good.
Yeah, that'd be great.
Does sound good.